Newborn jaundice is yellowing of newborn skin and whites of eyes. It is quite common and develops due to excess buildup of bilirubin. The yellow pigment produced during the breakdown of red blood cells is common in babies born before 38 weeks of gestation, preterm babies, and babies who are not adequately fed with breast milk or formula milk. It generally occurs as the baby's liver is yet to mature to effectively remove the bilirubin, and other underlying health conditions might also cause newborn. What causes the disease in children and adults? Hyperbilirubinemia. Excess bilirubin is the cause of jaundice. The newborns generally secrete more bilirubin than adults due to faster production and breakdown of red blood cells in the initial few days of life. Generally, the liver filters bilirubin from the bloodstreams and releases it into the gastrointestinal tract. The neonate's immature liver cannot filter bilirubin rapidly, which leads to the spike of bilirubin levels. This type of jaundice is categorized as physiologic jaundice, and it shows on the second or third day of life, which is harmless and settles within 2 weeks. Other disease conditions that can cause newborn jaundice includes hemorrhage, sepsis, bacterial infections, a mismatch between mother's and baby blood, liver disorder or malfunction, enzyme deficiency, and malfunctioning of newborn red blood cells that leads to rapid breakdown. Symptoms of jaundice in infants. The first and foremost signs and symptoms of newborn jaundice is yellowing of the skin and whites of the eyes, typically observed between 2 or 4 days of birth. Yellow eyes? It could be jaundice. The normal values of total bilirubin range from 0.3 - 1.0 mg or dl, and the normal direct bilirubin value is 5.2 mg or dl within 24 hours of birth. Generally, phototherapy is started when the total serum bilirubin level is at or above 15 mg dl in newborns within 25 - 48 hours of birth. Preventions. Doctors suggest the mothers feed the newborn frequently, which provides them with more milk and improves the bowel movement that allows the excess amount of bilirubin to be excreted via the stool. If the babies are not getting enough milk and not gaining weight or dehydrated, then consult with your doctor.